Layla, how are you doing?
I'm good.
Great. Well, today we're going to work on our L sound. I know we've been practicing it at the end of words, but today we're going to practice it at the beginning of words. Remember that the L sound is our la 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 singing sound, and we keep our tongue tip up and behind our front teeth like this. La. Okay, now we're going to go through some cards together, and you're just going to sit and listen closely, okay?
Okay.
All right, first, on this side, we have a yam. A yam is a vegetable that we can eat. On this side, we have a lamb. A lamb is an animal who lives on a farm and has fuzzy wool. Now we have lawn. It is the grassy area outside a house. Here we have yawn. Whoa, this is something we do when we're sleepy. This is luck. This picture is a lucky 3-leaf clover. Luck means we have a better chance of something good happening to us. This is yuck. Yuck is something we say when we think something is smelly or gross. Clinician would keep going through all 10 picture cards with Layla, modeling the y and l sounds and providing a brief definition. They are completing the familiarization part of the minimal pairs approach. In this activity, the clinician is using the procedure of modeling. They say the l sound out loud and right in front of Layla so that she can see how it should be produced. The modeling also helps Layla to get better at hearing the difference between the y and l sounds. All right, Layla, now we're going to play a fun game. On this basket, we have lamb, and on this one, we have yam. Now, I'm going to say either lamb or yam, and you'll take one of these balls and throw it into whichever basket that has the word you think you hear. So if you hear me say lamb, you would throw it into this basket. All right, let's start. Lamb. Good. Lamb. Yam. Good job. Lamb. Yam. This activity would be completed with the rest of the minimal pair cards to help Layla to listen and discriminate between the y and l sounds. Okay, you see all these cards on the counter?
Yes.
Now I'm going to call out one of the words and you'll pick it up for me. So if I say less, you'll pick up less. When you pick up the right card, you get to pop one of the poppets.
Yay, okay.
All right, let's start. Yacht. Good job. Lot.
Lot.
Good. Go ahead and pop your poppet. Lamb. Good job. Yam. Good. Yes. Great. Less. Good job. Yuck. Good. Luck. Oh, did you hear yuck? I had my tongue tipped up and I said luck. All right, let's try the next one. Yawn. Good job. Last one, lawn. Good, you heard our singing sound. These past two activities were part of the listening step of the minimal pairs approach. Layla did not have to practice producing the l sound at all. She just listened to the clinician to help her practice distinguishing it from the y sound. All right, now we're gonna switch. So you tell me which cards you want me to pick up. If you say our singing l sound correctly, then you get to pop the poppet again. All right, let's start.
Yam.
Did you mean yam?
No, I meant lamb.
Oh, I'm hearing yam. Remember to use our singing L sound and keep your tongue tip up like this. Lamb. Now you try.
Lamb.
Good job. In that clip, the clinician used the procedure of requesting for confirmation or clarification. Asking Layla what she meant will help prompt her to correct her errors. This procedure is important because it helps her practice her L sound, and it also encourages her to speak up to correct communication breakdowns. All right, let's keep going.
Yes. Yam. Yes. No, I mean yes.
Okay, I'm still hearing yes. Remember your singing sound. La, 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 less. Keep your tongue tip up. Now you try.
Less.
Perfect. You kept your tongue tip up and I heard that singing sound.
Yay.
In that clip, the clinician used verbal cues as the procedure. They taught Layla a metaphor for the L sound, her singing sound. They also verbally reminded her about her tongue placement, saying that she needs to keep her tongue tip up. These verbal reminders can help Layla keep her attention on producing the L sound. All right, next.
Lot.
Great job. I heard that singing sound.
Yawn. Yawn.
Did you mean yawn?
Yawn.
Oh, I didn't hear your singing sound. La, 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 lawn. Remember to keep your tongue tip up like this. This is how your tongue should be. Your tip of your tongue should be up and behind your front teeth, like this. Lawn. Now you try.
Yawn.
I'm still hearing yawn. This is how your mouth should look. Lawn. Now let's try looking in our mirror so we can see if our tongue tip is up. Watch me first. Lawn. Okay, now you look and make sure your tongue tip is up.
Lawn.
Great job. I heard that singing sound. In that clip, the clinician used visual cues as the procedure. They showed her a diagram of how her tongue should be placed, and the mirror helped her check to see if her tongue tip was up. These visual cues can help Layla focus on how she needs to move her tongue to produce the L sound. This can also help her differentiate between the Y sound and the L sound, and how they feel differently in her mouth when she produces them. Let's go with the next one.
Yacht.
Yacht.
Yuck.
Yuck.
Luck.
Look, good job. That was such a great job keeping your tongue tip up, Layla. I heard that singing sound. All right, now we're going to do this one more time. Final activity was part of the production step of the minimal pairs approach. It will be repeated a second time in order to give Layla 10 total attempts to say her initial L sounds. The session goal was for Layla to correctly produce the initial L sound in 8 out of 10 attempts with 2 or less cues from the clinician. The clinician should keep track of Layla's errors and how many cues she needed with each attempt. Then, they should score her using the provided data sheet to determine if she met the session goal.